Imagine this. You've got a young piglet growing like crazy, looks the picture of health. Everything seems great. But then suddenly you see it maybe a little limp or maybe it's really struggling to walk. And it's not just, simple twist or bump. What if I told you it's actually part of this like hidden problem, something that affects almost every pig in modern farming, even if they look fine on the outside? Today, we are doing a deep dive into osteochondrosis OC, for short, in growing pigs. People in the industry often just call it leg weakness, and honestly, it's a massive issue. Big impact on welfare, big impact on farmers. We've gathered a whole stack of research papers and detailed guides on this, and our goal here is really to cut through all the technical jargon, give you the essential rundown of this condition, and maybe uncover some surprising things about how pushing for super fast growth can mess with an animal's body in ways you wouldn't expect. Because this isn't just a minor injury, it's a complex developmental thing tied right into the biology of these fast-growing animals. Okay, so let's try and unpack this. What exactly is osteochondrosis? Fundamentally, it's a disorder, right? Affecting cartilage and bone development, specifically in young, growing pigs. Think of it like a flaw in the blueprints during really rapid construction. See, normally as a pig grows, cartilage is meant to be replaced by bone in this really orderly way. It's called endochondral ossification. But with OC, that process kind of glitches. The cartilage doesn't mature right, it gets too thick, and it just fails to turn into solid bone properly.
Exactly. And this thickened cartilage, it's weak, it's vulnerable.
Right.
So it can crack, it can even break off, forming these little flaps of cartilage inside the joint.
Oh, wow.
And that's what leads to the problems. You see the joint damage, the inflammation, obviously the pain and lameness. And eventually it can cause serious joint degeneration, like arthritis.
And you mentioned it's most common in fast-growing pigs, especially in intensive systems.
That's right. Because that accelerated growth puts so much demand on the skeleton while it's still developing. And what's really kind of mind-blowing here is that the core issue is that disruption in endochondral ossification. That orderly cartilage to bone replacement just goes off track. It's meant to be precise, step by step. When it doesn't happen right, you end up with these weak spots, these areas of thick, fragile cartilage just waiting for trouble.
Trouble like physical stress or injury.
Precisely. And what's truly striking, like you alluded to earlier, is the estimate that nearly 100% of finishing pigs in the U.S. have some degree of subclinical OC.
Subclinical meaning they have it, but you can't see it.
Exactly. They have these microscopic lesions, these faulty areas, but no limp, no obvious signs. So it's like this underlying vulnerability that's almost universal in these populations.
Wow, 100%. That's pretty staggering. It suggests this is almost baked into the system of modern pig production, which immediately makes you ask, why? What causes it? If it's that common, it can't just be one thing, right? It just sounds really complex.
It is absolutely complex, yeah. And if you look at the big picture, OC is really what you call a disease of production. Its roots are multifactorial. Think about it. For decades, we've been intensely selecting pigs for super fast growth and lots of lean muscle.
Right, for efficiency.
Exactly. But that puts incredible biomechanical stress on skeletons that are still maturing. Compare that to, say, a wild boar. They take maybe 2 years to mature, and you hardly ever see OC in them. Modern pigs are pushed to market weight in, 6 months? It's a huge difference.
It's like asking kids growing bones to handle an adult workload.
That's a great analogy. So genetics are definitely a big factor. We know it's heritable. Estimates are around 0.1 to 0.5, which means it's moderately passed down.
So breeding choices matter.
Absolutely. Certain fast-growing breeds, landrace, large white, duroc, they're known to be more susceptible. And then there's the rapid growth itself. Just gaining weight quickly puts more physical stress on those developing joints and cartilage.
Okay, so genetics and growth rate. What else?
Nutrition, it plays a huge role. Imbalances or deficiencies can really contribute. The ratio of calcium to phosphorus, for instance, is critical for bone building. Get that wrong. And you can end up with soft bones osteomalacia.
Okay.
Other nutrients are key too. Zinc, vitamin D, copper, biotin. They all need to be balanced.
And are there things in the diet that can make it worse?
Yes, actually. Too much vitamin A, specifically over about 20,000 IU per kilo of feed, seems to interfere with the growth plates. And there's some evidence, though maybe less conclusive, that high levels of lysine, an amino acid pushed for lean growth, might also increase the risk.
Interesting. So it's a delicate balance.
Very delicate. And then finally, you have the environment and physical stress. These are often the triggers that turn those hidden subclinical lesions into actual painful lameness.
So the underlying problem might be there, but something needs to set it off.
Exactly. Even minor bumps or slips pigs fighting a bit after mixing, slipping on concrete, sudden twists that can be enough to fracture that weakened cartilage.
Ah, the flooring makes sense now.
Huge factor. Hard, slippery concrete is tough on joints. Poorly designed slatted floors can cause slips and put weird twisting forces on the legs. High stocking density adds stress too, just more jostling, maybe dirtier pens leading to slips.
What about exercise? Is more always better?
It's a balance, actually. Too little exercise and confinement might mean bones don't develop optimally. But interestingly, sometimes free-range pigs can actually show more severe lesions, probably because they're moving more and putting more load on those vulnerable joints. It's complicated.
Wow. So it really is this perfect storm of genetics, nutrition, environment, and just sheer speed of growth. It highlights how everything's connected in development. So if this whole faulty construction process starts small, how does it actually unfold inside the pig? Take us through that journey, from the hidden flaw to the visible problem.
Sure. So OC develops in stages. It starts microscopically, that's called osteochondrosis latens. This involves a failure of the tiny blood vessels supplying the rapidly growing cartilage, basically ischemia.
Okay, lack of blood flow.
Right.
Yeah.
Then it can progress to osteochondrosis manifesta. At this stage, the cartilage doesn't ossify, doesn't turn to bone properly. It might become necrotic, so some cells die, it gets thicker, more fragile. These lesions, you could see them on an X-ray or if you examine the joint after death, but critically, they're usually still subclinical.
So no lameness yet.
Typically not. And many of these manifesta lesions actually heal on their own. This is where that nearly 100% statistic fits in. Most pigs probably have these somewhere. The really problematic stage is osteochondrosis dissecans, or OCD. This is the clinical stage. This happens when some kind of trauma or stress causes that weakened manifesta cartilage to actually fissure, crack, or break off. You might get a loose flap or even a free-floating piece of cartilage in the a joint mouse.
Ouch.
Yeah. And that's what triggers the significant inflammation, the pain, and the lameness that you actually see.
That progression makes a lot of sense. From hidden vulnerability to a visible lesion to a painful problem triggered by stress.
Huh?
So when it does become clinical OCD, where in the pig's body does it usually show up? Are there specific hotspots?
Oh, definitely. OC lesions tend to pop up in very predictable spots, basically, the joints that take the most weight and have the most movement. So think elbows, stifles, which are the pig's knees, hocks, which are like the ankles and shoulders.
The major limb joints.
Exactly. And even more specifically, within those joints, it often affects the ends of the long bones. Places like the rounded ends of the femur and the stifle, or the humerus and the elbow and shoulder. The technical names are medial condyles, humeral head, things like that.
Okay.
And what's really interesting diagnostically is that the lesions are often bilateral, meaning they occur in both legs, left and right, and often symmetrical.
Both legs. How does that affect how they look when they walk?
Well, it can actually make lameness harder to spot sometimes. Instead of clearly favoring one leg, the pig might just adopt this kind of stiff, cautious, shortened stride, trying to minimize pain in multiple joints at once.
Ah, so not a classic limp, necessarily.
Not always, no, which makes careful observation really important.
Okay, this is getting really critical for anyone actually working with pigs, recognizing those signs and figuring out if it's OC. Given that almost all pigs have the subclinical form, what are the key things to look for that tell you, okay, this has crossed the line, we need to act?
Yeah, good question. The clinical signs usually start showing up when the pigs are, say, 16 to 20 weeks old, that rapid growth phase. The most obvious sign, of course, is lameness. It might come and go or be persistent. It often gets worse with exercise, and you'll usually see it more severely in the heavier pigs in a group.
Makes sense, more weight on the bad joints.
Exactly. You might also see visible joint swelling elbows, stifles, hocks puffing up. Sometimes there's fluid buildup inside. Vets call joint effusion.
Okay.
Behaviorally, these pigs are often reluctant to move. They'll spend more time lying down than their pen mates. When they do get up or move, their gait is stiff, maybe awkward, especially that first movement after resting.
And does it affect their growth?
Absolutely. In chronic cases, because of the pain and maybe difficulty getting to feed, you'll often see a drop in their growth rate compared to healthy pigs. And in really advanced long-term cases, you can even get actual deformities in the joint shape.
Wow. Is there a difference between like a sudden onset versus a slow developing lameness?
Yes, we often talk about acute versus chronic disease. The acute form usually involves a sudden cartilage fracture, so you get sudden, intense pain. The pig might abruptly refuse to put weight on a leg, walking on three legs. You might even feel or hear a crepitus, a sort of grinding or clicking in the joint if you manipulate it gently.
Yikes.
Yeah. The chronic form is more gradual. The pig develops an abnormal way of walking over time, usually no fever, maybe no obvious swelling unless there's also been a fracture.
And you mentioned specific ways they might walk.
Right. You might see things like front legs, knees bent inwards, maybe walking right up on their toes with a really long stride, or the pasterns, kind of the ankle area might drop down. In the back legs, they might keep their legs tucked under their body, turn their hocks inwards, do this weird goose stepping thing, or sway their hindquarters. And some pigs find this unusual dog-sitting position helps relieve the pressure.
Those are incredibly specific observations, really paints a picture. So if a vet sees these signs, how do they actually confirm it's OC and not something else? You said no blood tests.
Right, no simple blood test. Diagnosis really relies on putting pieces together. First is the clinical exam, looking at the pig's age, its breed, how fast it's growing, the type of lameness, which joints are affected, and importantly, checking for things like fever or widespread swelling that might suggest infection. So, finding that characteristic lameness in a fast-growing pig without a fever makes OC a strong suspect.
Kind of a process of elimination?
Partly, yeah.
Well,
Then radiographs, x-rays are really useful. They can directly show abnormalities in the bone shape, potential cartilage defects, or signs of joint degeneration in a live animal.
okay.
But the gold standard, the definitive diagnosis, is usually post-mortem examination, a necropsy. There you can physically open the joint and see the thickened cartilage, see the flaps or cracks, see the damage to the joint surfaces.
Right, you can see the direct evidence.
Exactly. And for really fine detail, looking at tissue samples under a microscope histopathology can confirm that abnormal cartilage structure and the lack of proper bone formation.
And I guess differentiating it from other causes of lameness is key, right? You wouldn't treat an infection the same way.
Absolutely crucial. You need to rule out things like infectious arthritis, mycoplasma infections, or swine erysipelas are common culprits there. They often do cause fever and more general joint swelling. You also need to consider simple traumatic injuries, fractures, sprains, which usually have a clear history of sudden onset after an event, and other metabolic bone diseases like rickets, which is often related to severe vitamin D or calcium phosphorus issues, need to be considered too. But OC has those specific cartilage and bone-in lesions that are characteristic.
It's fascinating how the diagnosis involves careful observation, imaging, and sometimes even looking inside. Okay, let's shift gears. Once OC is diagnosed, what can actually be done? You mentioned the cartilage damage itself can't really be reversed.
That's the tough part, yeah. Once those cartilage lesions are there, especially the OCD kind with flaps and cracks, there's no magic bullet to make them disappear or heal perfectly back to normal. So the focus really shifts to managing the symptoms and, crucially, preventing it in the first place.
So for a pig that's already lame, what does management look like?
First thing is rest. Reducing the mechanical stress on those damaged joints is key. That means moving the pig to a pen with soft, comfortable bedding, deep straw is great.
That pressure off.
Exactly. Pain management is also really important for welfare and to help them move a bit better to eat and drink. We use NSAIDs, non-steroidal anti-inflammatory drugs, things like flunixin or meloxicam. They help reduce the inflammation and ease the pain.
Okay.
Sometimes nutritional tweaks can help. Ensuring the diet has the right balance of calcium, phosphorus, and those other key minerals and vitamins is important. In some cases, if pigs are growing excessively fast, slightly reducing the energy density of the diet might be considered to slow things down a bit, reducing skeletal stress.
And the environment.
Modifying the environment is critical too. Non-slip flooring is a must, making sure they have enough space, not overcrowded.
What about surgery? Is that ever an option?
Technically, yes. In very valuable animals like breeding boars, sometimes surgery is done to remove cartilage flaps or clean up lesions. But honestly, in commercial pork production, it's rarely practical or cost-effective.
Right. So what often happens with severe cases?
Unfortunately, for pigs with severe chronic lameness due to OC, the prognosis for recovery can be poor. In those situations, timely euthanasia or culling is often the most humane and economically sensible decision. It's really important, though, that any lame pig identified is moved to a dedicated hospital pen with good bedding and easy access to food and water while decisions are made or treatment is attempted.
That makes sense. A tough reality. Which really underscores the importance of prevention then.
Absolutely. Prevention is where the real effort needs to be, and it has to be a multi-pronged, holistic strategy. It starts way back with genetics. Selecting breeding animals gilts and boars not just for growth and lean meat, but also for structural soundness. Good leg conformation, strong feet. We should actively avoid breeding animals that show signs of leg weakness or have poor leg structure, like being too straight-legged, which increases concussion.
So building a better foundation from the start.
Precisely. Then nutrition again. Ensuring diets are meticulously balanced for calcium, phosphorus, zinc, vitamin D, copper, biotin, all those things crucial for bone health, and avoiding excesses like too much vitamin A, or maybe being cautious with extremely high energy or lysine diets, especially during key developmental periods.
Got it. Balanced, not just maxed out.
Right. And then environmental management. Providing good quality flooring that offers grip that isn't too abrasive. Ensuring adequate space per pig, avoiding severe overcrowding. Managing pigs carefully when mixing groups to minimize fighting and potential trauma. Basically reducing those biomechanical stresses and triggers we talked about earlier.
It sounds like a lot of interconnected factors to manage.
It is. And controlling growth rate to some extent, especially in developing breeding animals, is also part of the puzzle, avoiding pushing them so fast that their skeleton can't keep up.
Okay, so we've covered what OC is, why it happens, how it develops, how to spot it, and the challenges of managing it. Let's zoom out. What does all this mean for the bigger picture? You mentioned it's a big issue for the industry. What are those broader ripple effects economically and for animal welfare?
The impacts are really significant on both fronts. Economically, it's a major drain. Lame pigs obviously don't grow as well. They struggle to compete for feed and water, so their growth rate slows down, and their feed efficiency, how much feed it takes to gain weight, gets worse. That's direct financial loss for the producer.
Right, slower growth.
Mm.
Costs more to feed them to market weight.
Exactly. Then you have increased veterinary costs, time spent diagnosing, maybe cost for pain medication or supplements. And a huge hidden cost is premature culling, especially of breeding stock. Leg weakness, with OC being a major component, is one of the top reasons young gilts and boars are removed from the herd before they've really even started their productive lives.
Losing that genetic potential.
Absolutely. Culling rates due to leg issues in performance-tested animals can be really high, sometimes 20 or even 30%. That's a massive loss of investment.
Are there any numbers on the cost per pig?
There are estimates. For a single lame finishing pig, the loss might average around, say, $23 due to lost growth, treatment, etc. But for a breeding sow that has to be culled early due to lameness, the loss can be much higher, maybe $200, $300 or more, considering her lost future litters.
That adds up across an entire operation.
It really does. And another thing is joint condemnation at the slaughterhouse. OC lesions are a common reason for parts of the carcass, particularly joints, being rejected. This seems to be even more common in systems where pigs are more active, like organic or outdoor systems.
Interesting. More activity, potentially more stress on those vulnerable joints.
Potentially, yeah. And then overshadowing all the economics is the animal welfare aspect. We have to remember that progressing to clinical OCD with cartilage damage and inflammation is undoubtedly painful for the pig. Ensuring we minimize that pain and suffering through good management and prevention is a really significant ethical responsibility for the industry. It's a constant balancing act between production efficiency and ensuring good welfare outcomes.
This deep dive has really shown just how pervasive osteochondrosis is, starting almost invisibly, but with these huge consequences. It's clearly a complex developmental disease tied so closely to the way we raise pigs today that focus on incredibly rapid growth and lean muscle. We've seen its multifactorial genetics, nutrition, environment management all playing a part. And while fascinatingly, most pigs might have those subclinical lesions, it's that progression to the painful clinical stage that causes the major economic headaches and serious welfare concerns. As we wrap this up, it makes you think how understanding something like OC in pigs might actually give us broader insights into growth, into biomechanics, nutrition, maybe even in other animals, or perhaps parallels in human development. This whole idea of a disease of production really forces us to think about that trade-off, that balance between pushing for maximum efficiency or speed and maintaining fundamental health and well-being. What aspects of rapid development, whether in farming or technology or even our own lives, do you think might create similar vulnerabilities if we don't pay attention to the underlying foundations? Something to chew on.